We're going to define some agencies and the scope of practice of the technologists. So, venipuncture for the administration of contrast media historically has been done by radiologists, also by nurses. Although many radiographers are allowed to perform venipunctures, hospital policies still prohibit this practice. But it does fall within our scope of practice. But we are finding out that more and more hospitals now are depending on the technologists to perform venipuncture, again, more specifically for the administration of contrast media. So before we move forward, I need to share with you a few of the agencies who are responsible for our scope of practice. The first one here is the Joint Review Committee on Education in Radiologic Technology. You guys should be familiar with this particular agency and group because they are the ones who accredit the RadTech programs. So our program is accredited by the Junior Cert. So what they do is they define and promote the educational guidelines through the accreditation of educational programs in radiography, therapy, MRI, and also medical dosimetry. So they play a big role in our education. Also, we have what's the American Society of the Radiologic Technologists, which is the ASRT, not to confuse with the ARRT, because the ARRT is what gives you your license. This is the society, the American Society. And they are the national organization that develops and updates guidelines for education programs. They also define the technology scope of practice. So with the ARRT, the ASRT are very influential in also our education and our scope of practice. In fact, when you guys get your license, the ASRT is the main body, one of the main bodies that provides you with continued education units. Okay? So heavily involved in our profession. Then we have the ACR, which is the American College of Radiology. They are an organization dedicated to advancing the science of radiology. Number 2 is to improve radiologic service to the patient. 3, study the socioeconomic aspects of practice of radiology. And 4, encourage the improved and continuing education for radiologists and allied health professionals. It is a society of radiologists, but all the other healthcare services are also they look to the ACR for advance and also promotion of the field. So how did this come about that venipuncture for the administration of contrast media fell into our scope of practice? So here's the timeline. So the ACR, this is American College of Radiology, in 1987, resolution number 27, established support for the venipuncture and administration of drugs as part of the job of description for radiographers and radiation therapists. So this is back in 1987. In 91, the American Society of Radiologic Technologists approved the incorporation of venipuncture as part of the job description for radiographers and radiation therapists. It was amended again in 2006 and 2009. Now, all this is simply saying is that they recognize that this should be part of our scope of practice. Okay? They said that it should be. But again, there is a lot of resistance in the healthcare field. In 1993, Marianne Tortorici and Joe McDonald conducted a national survey to determine which states had a statute, rule, or regulation relevant to parenteral injection of radiopharmaceuticals or contrast media by radiographers. 26 of the 49 states that responded had some form of licensure. States containing vocabulary relevant to radiographers performing venipuncture includes California, Illinois, Montana, New Jersey, New York, and also Utah. All except New Jersey provided statements authorizing nuclear medicine technologists to administer drugs or contrast media. So, of the modality that did perform venipuncture, it was solely done by nuclear medicine technologists, but it was only within their their department for the injection of the radiopharmaceuticals. So it still wasn't a recognized practice that was done in the entire radiology department. So it's strictly done by medtechs at the time. Now, New Jersey prohibits radiographers and radiation therapists to perform venipuncture and inject drugs in contrast media. I'm starting to hate New Jersey. New York prohibits radiographers and radiation therapists to perform venipuncture. Okay, so again, it depends on the state. They all have their different statutes and policies relating to venipuncture. Now, California is very big in making sure that not only are we going to recognize it, but they say, you know, we should start performing it. So Senate Bill 1334, it's a bill regarding venipuncture for radiographers. The original legislation said in 1995, only were technologists allowed to complete an injection, which meant that the doctor would start the venipuncture, would inject about 5 to 10 cc's, and then he'll say, okay, go ahead and finish. So he'll start it and we'll finish it. Okay? So that was under direct supervision. We can finish it, but the doctor had to be within the room. Why does the doctor have to be in the room?
Reaction.
Okay, reaction. Okay, you guys already know that iodine can cause an anaphylactoid reaction. Okay, when we're saying anaphylaxis, that's a major and severe type of reaction. Okay, we're not talking about a mild or intermediate reaction. We're talking about someone who can go full-blown cardiac and respiratory arrest. So the doctor had to be within the room during the completion of the injection. Effective January 1, 1996, under Senator Wright. Again, this is a California representative. The physician need only be immediately available, which meant that the doctor can start it, we can finish it, and the doctor need not be in the room. They should just only be easily accessible, which meant they can go back to the reading room as long as they can come back immediately if there was some complications. So complications is not only about anaphylaxis, but are there other types of complications that can occur while you're pushing something through an IV? Okay, so you can cause infiltration. Okay, so you can blow the IV, and you can cause a lot of damage to the surrounding tissue and muscle at the injection site. Okay, any questions so far?
Question. The injection in the IV is not going to take that much long. I don't understand why the physician can start it and technician can finish it. I mean,
Don't
that
say
doesn't take
technician.
Technologist.
Okay, start all over.
We're about to get in a fight right now.
It doesn't take that much long to, start and finish it. I mean, I don't understand that policy they made it. I mean, why the doctor can start and then he can walk away.
Why can't the doctor finish it himself?
Yeah.
Okay, have you ever tried to inject contrast using a 50 cc syringe on a 19-inch butterfly?
Takes a
Have
while.
you?
I don't have any clue.
Okay, well, okay. It takes this long.
Okay.
I'm making the face because that's the face that they make when they're pushing the contrast through in a syringe. You see them straining and they're shaking. They're holding the
Like,
syringe.
I'm done.
Yeah, and they're trying to push that contrast through. The contrast, because of the physics, you're using a larger bore syringe, okay, which means you need more pressure to force the material through. Secondly, contrast is thick and viscous, so it's not like, it doesn't have the same consistency of water. So now it's like pushing honey through a little hole with that much force. So I know it sounds as simple as doing it, but it does take a while and energy to inject the contrast. So while they're doing that, they're saying, I can be doing something else, like reading images rather than sitting here.
How many
trying to
cc's do you usually push?
Anywhere between 50 to 120
In one study? Damn.
in one study.
Do they have to have an 18 gauge or larger?
18 gauge or, you're talking about the bore?
20.
Yeah. You need something, yeah, you want something a little bit larger in diameter to draw the contrast, Okay, but you want something about 19-ish to push the contrast through. Because if it's too big, it's going to hurt. Because you also got to think about the size of the needle as it's piercing the skin in the vein. And you don't want it too small because now you can't push the contrast through. It's just too thick. Okay? But yeah, that's a good point. And that's the reason is because it takes a while to get that done. A lot of energy to say, you know what, I can be doing something else than sitting here trying to push that contrast through. Right? And also trying to start an IV, you know, just takes some skill. And if you're good at it, you should be able to access that vein right away. But if you don't, then it may take a little bit longer. And if you have a difficult patient who has difficult veins, then it can also take longer. And the doctors say, you know what, get somebody else to do this because I can better manage my time doing something else than having to start an IV and push the contrast. That's their mentality. Yeah, that's their mentality. Any other questions? Okay. Senate Bill 571. It amended in August 1997. It further defined the training, education, and scope of practice for the technologists performing venipuncture and the administration of contrast media. Because up until this point, it was the doctor started it, you finished it. Okay? First part was doctor had to be in the room. Then they amended it saying that you can finish it, but now the doctor doesn't have to be in the room. Now they're saying here is you can start it, you can finish it. Doctor doesn't have to be in the room, just easily accessible in case something were to happen. Okay, so this is the evolution. So Senate Bill 571, this is what it added, and this is why we're here today. So it says here the training and education, this is what has to be inclusive for you guys to perform venipuncture, which is you need to receive a total of 10 hours of instruction, including the following: anatomy and physiology of venipuncture sites, venipuncture instruments, intravenous solutions, and related equipment, puncture techniques, techniques of intravenous line establishment, hazards and complications of venipuncture, post-venipuncture care, composition and purpose of anti-anaphylaxis tray, and first aid and basic CPR. The second part of that is to perform 10 venipunctures under supervision. Now, when this came about, it wasn't specific in how we were supposed to obtain those 10 venipunctures. So there was still a lot of when and who we can do it on. Okay? So it was kind of left like that. So this is the didactic portion of it, but it was still in controversy is how we were going to get those 10 sticks. All right, and then down here it says, nothing in the section shall be constructed to authorize technologists to perform arterial punctures. So what does that mean?
Access to the artery.
Okay, we can't access the artery. What can we access?
Veins.
Only the veins, and what part? Which vein?
Upper extremities.
Upper extremity. That is our scope of practice. Okay? So California, the statute has been amended to authorize technologists under the general supervision of a physician and surgeon to perform venipuncture in an upper extremity to administer contrast materials if the radiological technologist has received certain training and education and has been issued a certificate. Any questions right now? All right. Then this came about. Senate Bill 1199 in effect in 2013. This made it more clear. How were we going to get our 10 successful sticks in training? It said you can either do it by a live human or a dummy arm. Because before it was confusing. They said you can only do it on a human. Somebody else said you can only do it on the dummy arm. This went to the Senate and they said you can do it on either. Okay? All right, so that's what it says there. Okay, any questions?
Do we need to know a specific date, year? I mean,
For what?
for that law?
Amendments.
Anything's fair game.
Woohoo!
Anything's fair game. All right, scope of practice, yes.
Do those 10 sticks get us the certificate, or do we have to do more sticks?
Okay, so here's the question. Do those 10 sticks get you the certificate? You complete the course, you get a certificate to perform venipuncture for the administration of contrast agent. Okay, very specific. Now, when you go to the facility, when you get hired, they're going to give you an additional certification for proficiency.
Okay.
Which in most cases, they say you have to do another 10.
And the hospital didn't hire without that.
Right, exactly. So you can't even get that far without you having that certificate. Now that you have this, it says, okay, as just part of your training and proficiency, you have to demonstrate it to us. So 10 more.
Let's go.
Okay, and it's 10. Some have just 5. And I asked Mr. Chutin and Ms. Pak, they said it was required for the technologists to have that certificate.
Yeah.
And I'm getting a lot of past students who thought their certificate was no good and they threw it away. I'm getting a lot of emails now saying, I need that certificate.
The tenant hospitals also.
Yep.
found
Right.
that way.
So they're making a requirement now as part of your scope of practice and as part of your hiring to have that certificate. Okay. All right, so let's talk about liability in your scope of practice, all right? So, did we say scope of practice? Oh, scope of practice. Scope of practice is a terminology used by state licensing boards for various professions that defines the procedures, actions, and processes that are permitted for a licensed individual. The scope of practice is limited to that which the law allows for specific education and experience and specifically demonstrated competency. Each state has laws, licensing bodies, and regulations that describe requirements for education and training and defines the scope of practice. Okay, so what does that mean in those terms? Well, let's say a radiographer is sued as a result of negligently performing an injection that has caused some injury. So, investigate scope of practice. Since the recently redrafted scopes of practice include venipuncture and pharmacology, the attorney cannot claim the radiographer acted outside of the scope of practice because it is within your scope of practice, right? It's not like you're performing venipuncture because you weren't licensed to do it. You are licensed to do it. It's within your scope of practice. Now, what they can do is find out is whether or not you have the proper training and education to perform a proficient venipuncture. And they can get you on that and get you for negligence. Okay? But they can't get you for malpractice because it's part of your scope of practice. Okay? Therefore, it is important that radiographers be properly trained in venipuncture technique and contrast media or pharmaceutical administration. Most importantly, radiographers must periodically update their knowledge of contrast media and radiopharmaceuticals. So doing the venipuncture is just a small part of what you need to know. It's everything related to that you need to know, which are the complications and injury that you can cause by venipuncture. Not venipuncture. Venipuncture, again, is just part of it, but it's the administration of contrast media and knowing what to do if someone goes into an anaphylactic reaction. Because it used to be the doctor was in the room. If someone had an anaphylactic reaction, they were there to perform life-sustaining procedures. Now, it's you perform venipuncture, make sure there's no complication with the venipuncture. You want to be able to recognize any type of symptoms when someone is going into having some type of allergic reaction. And then what do you do when somebody does go into some type of reaction? So those are the things that we're going to be talking about the next few weeks. So the doctrine of personal liability. Each person is responsible for his or her own actions. Radiographers must take responsibility for the practice that they perform. They must understand what they are doing, why they are doing it, and how they are expected to perform.
Question?
Yes?
So just to clarify, so you can't be sued for malpractice, but you can become guilty of negligence?
Right. Okay, are we good?
Mm-hmm.
All right, so first off, yes. It can be for both. So when somebody gets sued, the person suing can go after you and then can go after the hospital because you are an agent of the hospital. So there can be two lawsuits. And then what can also happen is if the hospital does lose some money because they have found you guilty of your own negligence, now the hospital is going to go after you.
You're screwed.
Yeah. Okay. Blood. What's up?
What's up, blood?
Okay. Blood is a specialized bodily fluid that delivers necessary substances to the body cells and tissues, such as nutrients and oxygen. The average person contains 10 pints, 7 to 9% of the total body weight, and is composed of plasma and blood cells. A plasma. Plasma acts as the suspension. Acts as a suspension for blood cells. It is yellow in color. 90% of plasma is water. The remaining 10% contains food, oxygen, salts, fats, metabolic waste, respiratory gases, hormones, antibodies, and enzymes. Now I know you guys already know this, okay, but I have to deliver it again. So this is all review, okay?
What?
You speak loud. You just back there going, Well, I see it. You don't know that you're doing it, but you're doing it.
Her face doesn't lie. She's
I
very
know.
expressive.
Exactly.
It's hard. Totally. I can't.
All right. Blood cells, red blood cells, also known as erythrocytes. They have hemoglobin, which is responsible for carrying oxygen to the cells. The hemoglobin is also responsible for carrying waste away from the cells. They live about 120 days. It has a concave shape to allow for the hemoglobin. They have no nucleus, and they do not leave the circulatory system. The circulatory system is a closed system. It does leave the system if there is what? Injury. Okay, but it should stay within the system. White blood cells, or leukocytes, their principal function is to fight infection. They lack the hemoglobin, they have a nucleus, and they have the capacity to migrate through capillary walls into tissue fluid when there is injury. So one of the things that they do a blood test on you when you get sick. You run some labs, and what are they looking for to see if you're sick, if you have an infection, or if you have an injury?
Leukocytes.
Is they're looking at this white blood cell count. Okay. Platelets. What do we know about platelets?
They cause blood to clot.
Okay, they cause blood to clot. Okay, so primary function is to initiate the clotting process. Also seal small leaks in capillaries. They're not considered cells, but fragments of cells. So it depends on the school of thought again. Some say they are cells, some say they're not cells. What I'm putting up here is they're not cells, but fragments of cells. So if you get tested on this, they're fragments.
Got it?
For test purposes, they're fragments of cells, they're not cells. Okay? But again, there will be textbooks out there that will differ. This is just for us. Was there a question back there? So it's the fragments, okay? All right. The function. Blood vessels together with the four chambers of the heart form a closed system. For blood to flow, blood may only escape if there is injury, right?
Mm-hmm.
So the different vessels that we have, our circulatory system, we have arteries, we have veins, and then the smaller arteries and veins are capillaries, but we do have specific names for those.
Arterioles.
Arteries, okay. Arteries, what do? They carry blood to the tissues or away from the tissues?
To the tissues.
Okay, so they carry oxygenated blood to your vital tissues and organs. This is where perfusion occurs. Perfusion. Okay, so the tissues and organs get nourished, and whatever is left for waste gets sent back into the circulatory system to what now?
The venules.
To the veins, right. Okay. So the arteries carry blood from the ventricles, pumping chamber of the heart, out to the capillaries in organs and tissues, and the smallest arteries are known as arterioles. What's the biggest artery of your body called?
Aorta.
Right. Okay, capillaries. Capillaries allow for exchange between blood and body cells, or between blood and oxygen in lung tissues. Capillaries connect arterioles and venules. Okay, so the smallest arteries are arterioles, smallest vein is a venule. The two together form a capillary where the exchange of gases and nutrients occur. Okay, are we good?
Mm-hmm.
Am I going too slow? Yes. Veins. All right. Veins drain capillaries and tissues and organs and return blood to the heart, and the small veins are called venules. What's the largest vein called?
Vena cava.
Vena cava. How many do we have?
We have one. We have two sides of it. We have one.
Those are the trick questions that I write, right?
Okay.
One vena cava.
Trick questions, guys.
One upper, one lower.
But you have
Don't
sections.
fall
One's
for
upper,
it.
one's lower. Yes, but it's the same.
That's what I meant.
it's the
Kristen
same
was
vena
testing you
cava.
guys.
Okay. All right. All the vessels in the body may be subdivided into two groups or circuits. The first one is systemic. The second one is pulmonary. The systemic circuit are your arteries and veins that serves the body. They are the ones that carry blood to your vital tissues and organs and away from your body's vital tissues and organs. Okay, so that's the actual circulation of blood. So blood gets oxygenated in the lungs, right?
Mm-hmm.
Next step. What's the next step? From there,
Pulmonary vein.
blood goes to what?
Pulmonary
Goes
vein.
through the pulmonary vein, and then the left atrium. So there's your lungs, gets oxygenated through the pulmonary vein to the left atrium,
Left ventricle.
to the left ventricle,
The aorta.
and then out through the aorta to your tissues and organs. Okay? So that's your circulatory system. That's your that's the systemic system. Now we have the pulmonary circuit. These vessels carry blood to and from the lungs. They include the pulmonary artery, and it branches into the capillaries in the lungs as well as the veins that drain those capillaries. Now this is where it gets a little bit confusing, because you always think arteries carry the oxygenated blood, veins carry the non-oxygenated blood. This is where they differ, is in the pulmonary circuit. So in the artery, you have unoxygenated blood going through there, so they can become oxygenated through the lungs. Okay? So the pulmonary arteries carry blood low in oxygen from the right ventricle, while the pulmonary veins carry blood high in oxygen from the lungs to the left atrium. Okay? Questions there? You guys got this. Okay. So after the tissues and organs become nourished, you have the unoxygenated blood returning back to the veins, into the
Superior.
vena cava. Just one. Okay? Just the one. Okay? Because it depends if it's coming from the upper or lower part. Then it empties into the right atrium, into the right ventricle, and then through the pulmonary arteries to get oxygenation in the lungs. Okie dokes?
Mm-hmm.
You got this. Okay, anatomy of the blood vessel. Arterial walls. So arterial walls, the heart, the veins, they all have the same layers. Okay? But how they're constructed, how they're put together will differ because of the different pressures in the different sections of the vessels. Arterial walls are going to be much thicker, and they receive blood from the from the left ventricle, so they must be thicker. They got to be able to withstand the pressure coming from the left ventricle. The aorta is thickest wall is at 2.5 centimeters in diameter. The three layers resemble the three layers of the heart. Again, also similar with the vein. Arterioles are smaller and thinner, less elastic tissue, and relatively more smooth muscle. And the smaller arteries, or the arterioles. Veins. Veins are a little bit different in that they have valves. because in the veins, they're further away from the heart. There isn't a lot of pressure. So they need some assistance in trying to get that blood returned back to the heart. So veins have valves, one-way valves. Okay? So venules formed by the union of the capillaries. Vein walls become thicker as veins become larger. However, they are still relatively thinner than compared to the arteries because they don't have to be that thick because they're dealing with lower pressures. All right, they're easily collapsible, one-way valve, and also to assist the blood return back into the heart, we do that by moving. Okay, moving by just simple muscle contractions. Moving allows the blood to get back to the heart. Questions? Okay, veins are